house. Diana Ross, she's the author of Restorative Yoga for Breast Cancer Recovery, a guide for yoga students and therapists. Diana is a certified experienced yoga teacher and yoga therapist in the U.S. Her specific practice allows her to cross diagnostic barriers and meet students in their own time of need, and she helps assist them in learning how to respond to life in healthy, empowering ways rather than reacting to life circumstances. So Diana, we're so happy to have you here. Can you share with our viewers a little bit more about your background and what led you to start breast cancer yoga?
Well, thank you first, Wendy, for even inviting me onto the show. It's a pleasure. I started breast cancer yoga because it seemed like it was rampant in my family. Both my sister-in-laws had it, my cousin had it, my sister just died last month of it. I had it, and everybody I seemed to come in contact did. So I was ready to do service because ultimately a great yoga teacher finds her sole purpose in service. So it seemed like a natural, intuitive place for me to start. And I have a lot to offer through all my years of experience. So that's really how breast cancer yoga started. I had a yoga center, and it was thriving, did teacher trainings and all that, but I wanted more, and the more was the service, and breast cancer yoga was really the service. So that's how it happened, and it seems to be thriving, unfortunately and fortunately.
Right, the whole mix of emotions of being of service, and then what we are of service for. How long have you been studying and teaching?
I've been teaching since 1978. I did take a hiatus. I started my yoga career in the 60s.
That's fantastic.
It's been a long time. I'm probably an old school hippie on some sort.
Well, we appreciate the wisdom plus the experience to thread it into something that's more therapeutic. I wanted to ask you, when you do have a breast cancer diagnosis, where does a breast cancer patient start their yoga practice? How do they know what direction to go? How do they know who to contact? Where does a breast cancer patient start?
You know, that's a good question because it's not like I'm at the hospital or at the doctor's office. So you're really talking about educating the doctors in the hospital to do referrals. I mean, not obviously, my cards and my brochures are at the hospital, but rarely do I ever get a woman to come into my class that's been referred, because if they don't do it themselves, it's very hard for them to refer out.
Right.
So it's really lots of word of mouth. I work with the American Cancer Society. I'll go to a lot of or invited to present at their shows. A lot of cancer survivors that now want to serve also the community will ask me to come in and do yoga classes. We have one next week at Sag Harbor, a big one, and we'll be doing it to oncologists, so this will be very interesting.
Wonderful. Yes. Oh, I appreciate that. And it is. You have to be an educator in the field and get that word of mouth out. And then knowing that you have a fantastic website with breastcanceryoga.com. So when I thumbed through it, it was a fabulous resource on multiple levels. So I know that, having that search, people can find you.
But the truth of the matter is what I started, just like my service starting breast cancer yoga, I started an authority blog, and that authority blog has over 10,000 followers, which is great for a month or for a year.
Right. Congratulations.
And we have 80 contributors and growing.
Super.
So we share across the gamut.
Yes.
So because the main thing is to bring love into your life, love and joy, because it's the only thing, the way you're going to recover.
I know.
Move on. So the blog is the website is a destination, but the blog is very alive. Every day we're posting and there's dialogue, and so I want people to know that they can reach out, and they can personally reach out if they resonate with a particular contributor, because we're all here to serve.
We're all here to serve on our own level. And viewers, as you're coming to the program, we have Diana Ross here, who's author of Breast Cancer Recovery. and a guide for yoga students and therapists. She also has a fantastic website that is under her name, Diana Ross, at breastcanceryoga.com if you need to get a hold of her. She is a workshop presenter, a retreat facilitator, a master teacher trainer, and do note that this is, what we're talking about today is in complementary healing factors with what your doctor, is already doing to work with you. So we're looking to work with the whole person and not just a separation. So definitely consult with your doctor of what works for you. I wanted to continue to ask you, Diana, about breast cancer yoga. And how does it differ from, I want to say the general, because here we're in Scottsdale, Arizona, the general vinyasa classes, because that's what I see all the time when I go to the gym and the studios and our free community classes. It's usually vinyasa style, more power, more stronger, because I think our people want that physical part of the component then to work with their mind as a secondary, and it's a little bit harder to find the breast cancer or the specifics, the hatha yoga or, the new beginner type yoga. How does breast cancer yoga differ from your being here in Scottsdale, Arizona, the general vinyasa style yoga?
Well, I don't think they target the vinyasa yoga for breast cancer recovery. I'm safely to assume that, right?
Right.
It has to be specific. It has to be specific. And vinyasa is a synchronized movement with breath. And the breath is just absolutely at the top of the list of where to heal, when to begin. So, and vinyasa is on salutations, it's movement. Sometimes, for the most part, my orientation here is fast.
Mm-hmm.
I mean, I'm so slow, Wendy. I ask people to come in and lay down. And
I love it.
Sometimes they got up all the way to seated. Sometimes they don't.
Right. No kidding. I love going slow. If I want to go fast, I want to go out and run and hike, but it's really to face mind and body. If we're going too quickly, we might miss some of those whispers.
My breast cancer yoga is truly restorative.
Mm-hmm.
I spend the first 20 minutes, sometimes even 30 minutes, depending on how the energy I feel coming into the room, on breathing and connecting, quieting the mind, coming into the moment, and just being present to serve themselves.
Right.
And then we begin our movements. We may continue breathing in butterfly pose, Baddha Konasana. We'll bring the arms overhead, out to T, whatever they're able to do based on range of motion. So that's where I start. Mm-hmm. And props.
Beautiful.
I'm the prop maestro.
And I know that we have a fabulous cancer center here in Scottsdale, Arizona, Virginia Piper, where it's all mind body, and they would have the restorative yoga class for all cancer patients, and I loved it. It's just they only offered it once or twice a month. And for somebody that needs more of the healing and doesn't have a community nearby that they can go weekly, being able to connect to your website at breastcanceryoga.com and look at a lot of your products and what you do and what you have so they can, practice in their own home. And that leads me to ask you, as I was navigating through your website, about a DVD that you have on breathing. It's called Breathing with Purpose. And I would love for you to share with our viewers why we need a purpose to breathe. It's involuntary.
It's involuntary, and we unconsciously breathe every day. Mm-hmm. We never sit in a seat of gratitude that we even have our breath, because without it, we cease to exist. So it's a breathing CD where you have purpose to become conscious of the moment, connect to your breath, quiet the mind, and just let the chatter kind of dissipate so you can focus on what's most important. And it's usually right action. Now, what's really nice about my breathing CD is I walk you through each breath slowly. I don't let you wander off into meditation, but I keep you at the task of hand of breathing in and breathing out. Either full lung capacity, lower lung, Kapalabhati, forced exhalations, natural inhalations, Brahmari breath, the humming sound, raising the vibration. So it is very, very in the moment. You cannot wander off. I have your mind, the entire CD. So it's wonderful for those who say, I can't breathe. I just can't. I can't. It's too much. Well, all they got to do is listen and kind of settle down, get a quiet space, and keep trying because it's practice.
It's
It always
practice.
gets down to practice.
And to be able to have a DVD to come back to that practice, we get better at that which we practice. So all those different types of breathing styles, are those involved in your DVD?
Yes.
Yes. Super.
Well, I think in the DVD I have 4 breaths, but the CDs I go up to 11 breaths.
Oh, excellent. So then you can hit a track at any time from your, super.
All valuable.
No kidding. No, I know. It's because usually at times of stress, when you tune into your body, we're breathing shallow and fast, and it's just creating more havoc on our central nervous system. That's giving us more of the fight or flight when we really need that relaxation. So to be able to be guided by somebody, so it helps you get outside of your head, helps you relax. And it just, when we relax and slow down and, like you said, arrive back in the present moment, we're able to gather our resources. And maybe it's time not to decide on something. Maybe we need to sit with it longer. That's what I've learned from my teachers. You sit with it longer if you can't decide, because you need a few more knowledge sticks to carry on your bridge of life to make that decision. And that is what I so appreciate what you said about the breathing. I wanted to go to my industry. I started in fitness as a fitness professional, working with a lot of athletes, and I was a avid runner myself, a competitive runner. And as I'm getting older, the yoga reminded me that I'm a type A person, which I really thought I was a type B, and it got me to slow down and listen to my body with more of my, my inner wisdom and my outer intellect. However, I'm seeing more and more, and maybe it's just because of more people I know, but that are athletes and that are fitness enthusiasts or in the fitness profession are getting diagnosed with breast cancer or any type of cancer, and I'm watching them have a hard time slowing down and listening to what's going on the inside. I'm seeing more that they want to muscle through it, and not everybody, but just close at hand what I'm seeing. What type of advice would you share for our viewers of how this could be very detrimental to their recovery?
Well, if they were diagnosed with cancer and they have a vigorous exercise program, for me, is continue doing what you're doing if you love what you're doing, and the end result is the peace and calm that comes after the exercise, because that's why we do it, right? But if they're having these treatments, chemotherapy and radiation, then it's counterproductive, if that's what you mean.
Right, and how is it counterproductive? Because just the little advocate, the devil's advocate in me would say, well, if I'm having this, chemotherapy that's like this toxin going into my body, why don't I just sweat and push it back out?
Wow. Well, if they can, but I doubt if they can, because chemo brings a lot of people to their knees. They get neuropathy, they get nausea, they have bad days. So rarely do I ever see a person, actually I've never seen a person go through a chemo regimen and come out on the other side feeling like they can go run 2 miles.
Right, but what can you explain to our viewers why it's detrimental to counter that balance? Because what you had mentioned, your first insight was keep doing what you're doing if it's working, because our body, we get those neurotransmitters, we get those feel-good hormones, and they make us happy by nature. But for people that, for the athletes or the fitness enthusiasts that want to muscle through it, why is it detrimental? What are we doing to the system?
Well, if it's compounded with stress, fear, and anxiety, that fear is going to damage the mitochondrial cells. That is a given. And the immune system will crash. If the immune system crashes, then they're in for big problems.
And I think that's what we needed to hear. Thank you for sharing that, because our immune system is already compromised because of having a cancer diagnosis. Now we're pushing our system even more so. So really, that's where the breast cancer yoga comes in to slow down the system. What would you share? I mean, based on this same philosophy of, let's say, woman is an avid yogi. She's been, she has a strong practice, and she gets diagnosed with breast cancer.
Mhm.
This runs similar lines. Why can't she continue doing the form that she is already currently doing?
Well, again, Wendy, what is she doing outside? What are her treatments? What are her therapies? Has she changed her diet? Has she eliminated the negativities in her life? So it's not really isolated to her yoga practice, because that may be her salvation, because we love our yoga, right? We
Right.
don't give up our yoga, but that's not to say that we can't change how we eat, the company we keep. And again, if they start doing the treatments, the chemo and the radiation, that's a big chunk out of your body. And then if you do something like that, the body needs to rest.
Mm-hmm.
You need to rebuild the immune system. Um, you have to make sure your stress, your fear, your anxiety levels are low, bringing all the cortisol, all those stress hormones down, and making sure the GABA levels come up, so you feel at peace with what you're doing. So again, I've seen people continue their yoga practice, it's like being pregnant. Some people cannot do the practice. Some people continue well on into their pregnancy, but they've changed other things. They're willing to modify this or modify that. Are these people willing to modify when they need to by listening to their body?
Right. Well said. And that leads me to ask you a little bit more if there's anything else that you need to add. How does breast cancer yoga aid in recovery? What are the scientific facts that allow breast cancer yoga to really be helpful in recovery?
Well, it's scientifically already founded that if you reduce the stress, the fear, the anxiety, the immune system bounces back. The stress hormones decrease, just like I said, in the GABA levels. So rest. Breast cancer yoga is really resting yoga.
Yes.
You're on your back. And not occasionally, it's between seated and on your back. Rarely do I make them stand,
Mm-hmm.
unless we're having one of those days, the sun is shining and everybody's energetic and they're ready to do it. But for the most part, people come to deal with their neuropathy, deal with their nausea, continue to help move range of motion, neck pain, back pain, frozen shoulder, all that kind of stuff that comes. Working with their expanders or their new breasts. So it's gentle. It's gentle, it's quiet, it's accepting, it's safe. People want to feel safe, because what we've done with breast cancer is we've come and protected our chest. So everything is concave as opposed to being open. So it's allowing ourselves to draw our shoulder back, open our hearts, connect to our breath, connect to ourselves. We're beautiful beings. I always have them repeat, I'm magnificent.
I'm magnificent. I love it.
I love Diana.
Yes.
So all that's important. And it's
Yeah.
really just getting back in touch with yourself, opening your heart.
Yeah, being safe in all those vulnerabilities. And it's a haven, it's a retreat to go in and to get to know your heart and, work with each petal at a time to allow it to flower back open again.
Yeah. Well,
Yeah.
love is the answer.
Love is the answer. What's the question? Diana, I know being a yogi myself, whenever I would go to doctor visits and my husband would be with me, we would both either be doing yoga in the waiting room or in the actual closed room, and I'd take my husband through a sequence because it would get me out of my head and help me relax from, just listening to the instruction. Can you take me through a small sequence, 2 to 3 minutes or so, from being seated in a chair for women that might be watching this at their desktop, or women that could be reminded of what to take with them when they are in between doctor visits, and how to help quiet their mind and do a few postures just from a seated position that can be gentle and emotionally soothing?
Well, based on what I do right now, currently when I go to the doctors, I love to take a little essential oil and just smell maybe some sacred frankincense.
Mm-hmm.
It's a wonderful thing to put on your heart. I sit in a seat, my feet hip distance apart. So I feel this alignment, and I raise my spine, soften my shoulders. So I have a sense of that freedom, that divine connection from my crown up to God, or to the creator of all that is. And just sit in that seat, close my eyes, and for a moment it's just me. It's just me. And then I invite my breath in through my nostrils, and I ask, please fill up my lungs with beautiful, pure air. Exhale all the impurities, everything that doesn't serve me right now, out. Inhaling again, some nice, white, pure air, filling my lungs. Allowing there to be a gentle pause of transition, exhaling, softening, where I can soften, maybe my facial muscles, jaw hinge. And I continue breathing this full, complete breath. And at some point I might invite some love in. Just love myself. I may invite some peace in. And then I ask God, please make me an instrument of thy peace. Peace, peace, peace. Shanti, shanti, shanti. Again, I recheck, make sure my heart is open, my shoulders are soft and drawn back, my arms are resting, either in my lap, right hand on top of left hand, thumbs touching. Feet connected to Mother Earth. God, I know she's only sending up great balancing energy up through the body. Please, God, make me an instrument of thy peace. Peace, peace, peace. Shanti, shanti, shanti. Now, if they want to go further, as they continue to breathe, they might want to just turn to the right, and use a little resistance, taking their hand to the handle and just squeezing, taking a nice breath in and out, and then slowly unwinding, coming back to center, and then turning to the left and just doing a little squeeze. Taking a nice breath, exhaling, returning. If they feel tight, maybe just letting their head rest over to the right. Lifting up from the base of the spine to the crown of the head to center. Exhale, head to the left. Inhale again, all the way from base of spine. Exhale, let the chin come forward towards the chest. Again, lifting the chest, letting the shoulders rise back, stretching the back of the neck. And then maybe just allowing the ears and the head to roll softly from side to side. Staying with the breath. Head back to center. Connecting to the breath. Placing my hands again in my lap, right hand on top of left, thumbs touching, lifting the head up, maybe. And that's I do that. This is what I do when I go to the doctors. But it's really just sitting quietly with myself, eyes closed, and it doesn't really matter because I love everybody in the room with me. Nobody's said anything to me yet, so.
So you still love them.
Yes,
I love that you mentioned invite. When we invite something into our hearts, it gives us that opportunity to have permission for what it is that we're inviting. And it allows us to look at what might be in the way of our love. You had mentioned, seek that joy. What are we, we're all here to find joy. And if we're postponing our joy, what's happening to the interior of our bodies? And, when I wake up and have chaos going on in my dreams or in my emotions, I have to take that one step back and say, what am I doing that's creating this chaos that I don't feel like I'm in balance? And I think for me, the whole cancer journey as a patient myself has really allowed me to practice better discernment in my life, in my choices, and my boundaries. It's like you only have so much energy for yourself first, and then that overflows into your family, your friends, your work. And we have those few people that you had mentioned that keep us company, that support us, and those others that watch who we're hanging with, because it can be very depleting, and that's a huge message. I encourage you viewers to go to Diana's website at breastcanceryoga.com, navigate through the educational tools that she has built to help better your well-being and enhance who you are. And you can be doing your breast cancer yoga in the comfort of your own home if the community doesn't offer it as often as you would like. And also, I think when we fill our well and get in tune to our vulnerabilities, it's easier to step back out again and really discover who we are in this newness of self, this new chapter. Lovely. Thank you for taking me through that, because I love to be guided, and it's of your service for everybody else. And if you need to reach Diana, she's at Diana Ross at breastcanceryoga.com. Diana, as we close, how would you like to summarize to our viewers, maybe that are just checking in at this last portion of our time here on our Hangout, how would you like to, what's the big takeaway of breast cancer yoga?
I think if I was to impart anything to our viewers, is that it's so important to love ourselves. That is the first paramount thing that we need to do in recovery, and honor when we need to rest, set up our boundaries, learn to control what comes in and what goes out. You said it beautifully. It's true. We become very discerning, and I think that's really what it's all about. Gather information, but use your intuition. Your intuition is always telling you the truth. Don't be swayed by others. Use your intuition. Same with the yoga. If it's too much, if it doesn't feel right, it's too much. Don't go there. So always honor wherever you are at that moment in time, because it's never the same. You know, we have our great days and maybe not so great days. But I think just love. I mean, I sound like Ram Dass now, but it's true. Love is the answer. You have to let go of regrets, remorse, resentments. All that stuff has to go, and just really tune into love. I know it's and it's not easy. Well, I shouldn't say it isn't easy. It's easy if you practice, but one must practice it. And that's, I mean, I practice it every day, just to do something different, to do, you know, not to keep doing the same thing, looking for a different response, but to change it up. And usually it's always through love. So anyway, I thank you so much for inviting me. I ask people to go to my YouTube channel, because we have a lot of poses that I've done in class that I've videoed, so they get a sense of what they can do.
Beautiful.
Yeah, the DVD only has so much. And then on the blog, I post a pose every Thursday that they can try. Because it isn't easy finding breast cancer classes with people that really know how to treat somebody with a trans flap or with a double mastectomy or, you know, all that stuff. It's really important that they find someone, if they do find someone, that they value their safety. Excellent. Lymphedema, too, being huge to make sure. Breathing. Oh, continue breathing. It's the most important, right? Breathe in love.
Breathe in love.
It's
not always, you said it can be easy. It's not always easy, but it's simple. is what I have found out. It might not be easy, but it's, the simplicity of getting back to sit with yourself and get to know what's underneath your skin and get to
Mm-hmm.
befriend what's there, because our shadow is just as much as part of our lights, and we integrate that, we become a whole person. And I'm still learning. I teach as I go also, and I'm learning through the eyes of a student. So it's very much appreciative to have you here, part of our hangout. She is Diana Ross. You can find Diana Ross at breastcanceryoga.com. If you need to get a hold of Diana Ross, email Diana Ross at breastcanceryoga.com. We are so grateful to have you here today and to share your knowledge and all your research and what you're doing to help heal our planet. Thank you, Diana.
Thank you, Wendy, very much. Namaste.
Namaste. Bye for now.